Hello everyone. In this video lecture, I'll be discussing the first topic for the prelim, which is the part 1 of understanding phlebotomy. So for this discussion class, we will be, the objectives are the following. So the first one, we will go back to the history of phlebotomy, the evolution of phlebotomy, and we'll be comparing it with our current practice. And then next, we will be distinguishing the different types of healthcare settings in the Philippines. The next one is we will be reviewing the different areas in the laboratory because I know you already have a background during your PMLS1 on the areas in the lab. And other than that, we will be distinguishing as well the different laboratory staff inside the laboratory. And the last one is we will identify the 3 phases of sample processing. Okay, so now let's start, of course, with the question, what is phlebotomy? When we say phlebotomy class, it is the process of collecting blood. So if you're going to look into the definition of Webster, phlebotomy, it is the art or a practice of bloodletting as a form of therapeutic measure. So we have here illustrations class on how are they performing before when we say phlebotomy. So, before, they don't have the idea of what microorganism is, mga bacteria, mga viruses, wala sila nakabaloana. So, they thought na if nagkasakit ang isa ka person, it is because there's a bad spirit that entered the body. So, to cure that certain ailment, they need to cut a vein or any portion of your body in order to release the blood and to release that bad blood that was caused by the bad spirit that entered the body. So that is how they are performing phlebotomy. So we have here a picture on the left side. This is the leg of a Roman gladiator. So of course, unsa man ang trabaho ng gladiator, no? They are always in the battle. So right after the battle, the Roman gladiator experienced massive bleeding. So as their practice before, they are going to cut portion of the skin or any part of the body of this bleeding Roman gladiator and will be given further bleeding as the form of treatment. So unfortunately, there are instances where patients kay nangamatay no because of massive blood loss. Okay, another part of the history. So this one happened on the 12th century. So bloodletting, it was practiced by the barbers. Diba you are familiar with this symbol on the top portion? So we can see this one on barber shops. So why are they considered as why are the barbers kanang sila ang ga-perform og bloodletting? It's because class they have this skill in handling sharp instruments, just like kanang mga blades, kanang mga scissors. So, they are known before as barber surgeon. So, they used to perform bloodletting, they used to perform surgery, and even tooth extraction. And that is why that's the history of the red and white poles that is located outside these barber shops. Okay, historically class, phlebotomy used two basic methods. The first one is venesection. So, muna akong gi-mention earlier, katong gi-perform sa Roman gladiator. So, venesection, this is the most commonly performed before. They are using a sharp-like lancet instrument that will be pierced on the vein and made them bleed. So, just like in the picture. So, venesection can also be termed as lancing. Okay, so the vein was thought to eliminate the bad blood inside the body, and together with the removal of the blood, the disease will be removed as well. Okay. The second method of phlebotomy is the cupping. So currently, this one is called kanang ventosa ba na nang naay cup that will be placed at the back, at the person's back, and then the cup will be heated. And as the cup cooled, it created a suction. And through suctioning, of course, ang blood will be pulled as well. Okay? But before, their procedure is much worse compared with our kaning ventosa right now. So, that blood that was pulled up, it will be cut using a blade. So, this method produce much scarring. For example, 10 ka cups ang ibutang sa imuhang likod, therefore 10 pud ka slices or 10 ka cuts ang result sa imuhang procedure. So, it is very, very nang painful ang procedure nila before. Okay, so on December 1799, so the president of the United States before was George Washington. So he had a severe throat infection. So kay naa siya throat infection, the cure that was given to President George Washington was further bleeding or massive bleeding. So during this venesection, he bled more than 9 pints, or if you're going to convert it into liters, it will be 5 liters of blood in less than 24 hours. And because of that, he died on December 14, 1799. So after his death, the philosophy of bleeding as cure to disease change. It's because isa ka mga prominent na mga president died because of this type of procedure. That is why in the mid-19th century, bloodletting was no longer considered as a cure of ailments. Okay. So, we have here on the right portion, this is Anton van Leeuwenhoek. So he is the one who discovered the microorganisms as the causative agent for many diseases. That opened the way he started the change on how to treat diseases. So because of this, blood began to be examined for diagnostic purposes and not for as a form of treatment. Okay, so this one is another procedure of phlebotomy that they are performing before. This is called leaching. So, kung sa Bisaya, palinta. So, in this one, this is used for areas with clotting. So, pag nag-clot ang certain part of the body, subutngan og linta para supsupon ang dugo nga nag-clot. Okay, in order to allow proper circulation of blood in the system. But the problem that they have encountered in this type of phlebotomy class is that silinta, dali lang siya mabusog. That is why you need to have not only one, but more than one nalinta in order to suck that clotted blood. Okay, so this form of phlebotomy, this is a therapeutic type. Okay, so this one helps. Actually, this is a form of medicine as well, to help those patients with clotting mechanism and also to those patients with increased blood production, such as patients with polycythemia vera na condition. Okay, so that is the history of phlebotomy. So now, let us focus on the role of the phlebotomist inside the hospital or the healthcare setting. So, to collect blood for accurate and reliable test results as quickly as possible with the least discomfort to the patient. Okay, least discomfort, as much as possible, yes, sakit man yun ang blood extraction, but as much as possible, let us make it a little bit painful lang. So, it's wrong to say to the patient, ma'am, dili man ni sakit. So, be honest to the patient. I-inform si patient nga, ma'am, sakit ni siya but it's tolerable. That is how you properly inform the patient. Okay. So now, the different setup of phlebotomy type in laboratory. So most hospitals or laboratories in the Philippines is applying the centralized phlebotomy. So 85% of the hospital no ang naga-perform ani. So this type of phlebotomy, so sample collection wherein the phlebotomist is part of the laboratory team and is dispatched to hospital units to collect blood samples. Okay, so pwede ka ipa-add to sa mga different wards sa hospital to perform blood extraction. As to the decentralized phlebotomy class, only 15% of the hospitals are applying this one. So this is patient-focused care. So for example, si Nurse A, assigned siya kay patient 1. So tanan nga procedures, mga nursing procedures, as well as blood extraction, si Nurse A ang mag-perform. So the nurse must be trained on how to perform blood extraction. So the same way with the medtech. So if you are assigned to that specific patient, you will be taught as well mga different types of nursing procedure. Okay, as to the third type, which is the hybrid phlebotomy. So this is a combination of a centralized and decentralized. Okay, now for the different areas in the hospital. So it's very important not to identify what are the functions of the following areas in the hospital. It's because, of course, maglakaw-lakaw man yun sulod sa hospital, no? So naay mga pasyente or naay mga watcher na mangutana sa imuha, ma'am, asa ning kini na area? Para asa na siya na area? So that you will know, no, what are the functions of the following areas. The first one is administration. So it keeps the hospital in compliance. So sa mga permits, sa hiring, if ever na ikulang na medtech, mga sweldo, so they are the ones who are processing that one. Next is electrocardiography. So they are the ones who are monitoring the patients with cardiovascular conditions. Next is electroencephalography. So they provide diagnosis for patients with neurophysical disorders. Next naman, we have environmental services. So they help maintain the cleanliness of the hospital. So our janitors, our janitress, so they have this key role, no, in stopping the further spread of infection from patient to patient and also from patient to the hospital staff. Next is we have our food services. So they provide diets to the patient based on the diet restrictions provided by their doctors. The next one is our GI lab or gastrointestinal laboratory. So in this one, they are diagnosing patients with gastrointestinal disorders. And of course, we have the laboratory. So the laboratory provides testing of patient samples. And medical records, they are the ones who keep and maintain patient records up to its utmost confidentiality. So if ever dili ikaw ang magkuha sa imuhang mga laboratory results before when you were hospitalized, you need to give that person an authorization letter. Next is nursing. So they provide direct patient care. So we have here the occupational therapy class. So in this area of the hospital, they provide therapy to patients in order to help them maintain their living skills. Next naman is the pharmacy. So they are the ones who are dispensing drugs and advising the drug usage. So the next area, we have our physical therapy. So this area, they provides therapy to patients, na example, kanang na-disgrasya or na-stroke in order to restore their mobility. And then we have our radiology. So they are using imaging such as X-ray and CT scan in order to provide diagnosis and treatment for the patients. So next, we have our respiratory therapy. So it provides therapy in order to evaluate the lungs of the patient. And the last one is speech therapy. So it provides therapy to restore speech. So there are still so many hospital areas, but the following are the most common ancillary hospital areas that we can locate. Okay, the next one is areas of nursing care. So it's important to know these areas or the wards in the hospital because this is where we get blood samples for our inpatients. So, para na kay idea, pag tanaw nimo sa request form, uy, ako ang patient na sa pedia ward. So, imong patient is bata. Uy, ako ang patient na sa ICU. So, it means ang condition sa imuhang patient is critical. Okay? So we have here the coronary heart unit. So they focused or increased ang ilang attention for those patients with heart condition. Next naman is emergency department. Of course, patients that requires emergency treatment. If ever ikaw ang phlebotomy on that day and then na ay mag-page for the medtech on duty for blood extraction at emergency room, of course, you must prioritize that one. Next is geriatric. So, you will expect na ang patients tanan are elderly na mga patients. Next is ICU or intensive care unit. So, increased care was given to the patients with critical needs. Next, we have our neonatal. So, for our newborns. Next, nephropathy. So, patients on dialysis na sila mga kidney problem. Next is obstetrics. Okay, so patients in labor due to childbirth, mga buntis. Next is our oncology. This one is for our patients with cancer. And then we have orthopedic na area. So, patients with broken bones. And pediatrics, patients na mga infants and mga children. And we have the recovery room, so recovery treatment of patients after the surgery. So, this is usually located inside the operating room. Okay, now let's proceed with the different sections in the laboratory. Okay, so we have administrative office. So bisag dili ka medically inclined na individual, dili in line with the medicine imong gigraduatean, you can still apply in the laboratory and work as the administrative staff. So the paperworks, kanang mga calls, it will be handled by the administrative officer. So, phlebotomy, of course, collect samples from patients and process samples for testing and transport. And another section in the laboratory, we have the urinalysis. So, even though ang name niya is urinalysis, this is not only limited to urine samples. We are also processing mga stool samples, mga body fluids, such as CSF, peritoneal fluid, mga phlegma, so any other body fluids. Okay, so in this area, we are performing qualitative and quantitative chemical and microscopic examinations sa urine and other body fluid. So the most common condition na ma-detect for this in this area is the UTI. The next one is hematology. So in this area, it is usually limited to the study of cellular components of the blood, such as the RBC, WBC, the hemoglobin, hematocrit, and the platelet. So listed there, the different tests in the hematology section. And then we have coagulation. So usually class, this is the same area as the hematology. So this one involves the study of the clotting of the blood. So we have their examples as well of the different tests under coagulation. So kindly check what are the meaning of the following tests. During our quizzes, mga abbreviation will not be accepted. You need to spell out completely ang mga test. Next is clinical chemistry. So in this area, we are working with the fluid portion of the blood, which is the serum or the plasma. So we perform biochemical analysis of blood and other body fluids. So the following are the examples of tests under clinical chemistry. So kindly check what are the tests under metabolic panel, hepatic panel, and renal panel. So that will be your assignment, ha? So on our next meeting, dapat kabalo mo what are those tests. And then we have microbiology. So it studies the organisms that are too small and can be seen only using the microscope. So we are planting microorganisms, nagapatubo taog bacteria, and after magtubo, so we will put antibiotic and we will be identifying its susceptibility. So the doctor will depend on your result if unsa na medication or unsa na antibiotic ang gamiton for the patient. Next is immunology. So, it studies the antigen and antibody. So, generally, for the immunity of the patient. So, review, antigen, these are the substances that is foreign sa ato ang body. While antibody, it's our immunity that protects us no from any forms of antigen. So the following are the examples of the test under immunology: HIV testing, rubella, RPR, VDRL, and hepatitis testing. And then we have here blood banking. So this is considered as the most crucial area in the laboratory. It's because, class, we are transferring an increased amount of blood to our patient. So, dili siya ibig sabihin na si patient kay type A and then naatay donor na type A. Automatic ihatag na nato. No, it needs to undergo compatibility testing. So we term that one as cross-matching. I-process na to ang sample, and then pag compatible ang result, it means it is safe to be transfused to our patient in need. So other than cross-matching, ABO blood typing, RH typing, antibody panel testing are also performed under blood banking na area. So very crucial sa class, it's because pag nag-start na og transfusion, if ever mali di imong na-report, it's incompatible di ay. So dili na biya nimo siya makuha og balik ang imong blood nga nag-transfuse. Of course, it will result to negative na action on the body of our patient. Okay, so next, we have cytogenetics as well as molecular diagnosis. So not all laboratories have these types of advancements. So mga, kung ano yun na, no, mga highly advanced laboratories ang nag-perform for these types of tests. And of course, histopathology. So all of the part of the body that was removed during operation will be sent to histopathology for further testing. So we are going to process these samples for us to come up with these slides on the picture. And if nahuman na ang slides, it will be given to the pathologist for diagnosis. So sila ang magbasa sa slides and then mag-release sa results. So remember lang class, sa histopathology area, medtechs are not reading or releasing any result. It's the pathologist. It's because we are not trained no to read cancerous na mga slides. So, unsa man ang role ni medtech diri ma'am? So, clear only in processing the sample. Okay, we have here stat request. So this is for emergency cases. So we need to prioritize. And the testing must be done immediately. Then we have outpatient department. So patients who are not admitted in the hospital. Okay, so now let's proceed with the laboratory staff. So we have pathologist. So pathologist, it reads and interprets results, examines tissues under the microscope, and a laboratory cannot function without a pathologist. Okay, so it requires 5 years of training after graduating from med school for you to be an eligible and certified pathologist. Next are the medical laboratory scientists. And we also have our medical laboratory technician. So, scientist class board passer. Si technician, kaya wala siya nakapasa og board. So, still, ang ato ang mga medtechs na wala nakapasa og board, they can still work in the laboratory. But, minimal lang yun siya ng mga test ang allowed na i-perform nila and under the supervision of medical laboratory science. Then we have phlebotomy technician, of course, collects blood sample. And we have histotechnology. So assist the medtech assigned sa histopathology na area and performing preparation of body tissue samples for microscopic evaluation. Okay, so for the last slide, we have here the different phases of sample processing. So among these three class, the most important is the pre-examination. It's because the actual examination and the post-examination will be affected if ever dili tama ang imuhang pre-examination. Okay, so during the pre-examination are the following. Request form. So karon dili na kay na siya problema, no? It's because everything is already computerized. So before handwritten, na magmali-mali gyud ko kayo ang prone kayo og error. And then we have patient identification and information. So this is a very crucial as well. It's because if mali na imuhang patient, of course, mali na pud nga result imuhang na-release. So that is why how are we going to properly identify our patient? So, we are going to ask the patient to state their name. For example, ma'am, unsay imong pangalan? Ingon ana ha, dili na, ma'am, ikaw si Doren Utod. So that is very wrong. So let them state their own name. And for the sample collection, and of course, the next one is correct sample collection. So we need to follow the proper techniques no, in order to collect samples successfully. Then correct use of equipment, preparation of the sample and centrifugation, and maintaining sample integrity until the processing time. So during examination, of course, the actual testing, and sa post-examination, so reporting of the results. So sa una po, this is one of the problem no kay handwritten pud ang result, but right now everything is already computerized, so it's very readable na ang mga results. Okay, so that's it for the first part of understanding phlebotomy. I hope that you learned something. So kindly review and prepare for a quiz next meeting. So thank you everyone and have a great day.